It is time to check in again with our resident rugby league injury analyst, Brian Sini, the NRL physio.
Good to see you, Bossy.
Earlier this year on The Fan, we did a piece on players who'd gone through knee reconstructions, and it was a great insight from the likes of Peter Wallace, who's gone through 3 knee reconstructions in his career. But tonight, you want to tell us exactly what happens to the knee when they suffer this injury.
Yes, absolutely. So look, if we look over here, we've got the knee, we've removed all the muscles. So we're just left with the bones, the ligaments, the tendons. So if we move the kneecap out of the way here and we just look inside the knee, it doesn't look like much.
No.
We've got a thin little sort of pink strip here. That is your ACL.
Okay.
Now, funnily enough, that thin little strip is the most important structure in your knee for knee stability, particularly in those moments where you're changing direction, which tends to be the way that a lot of the players actually injure the ligament.
Yeah, well, I think back to players like James Tedesco on debut, out in open pasture. Ben Ikin, during his career, a game against the Warriors, just stepped, not touched by anyone, and the knee goes, the most serious of injuries.
So look, usually 70 to 80% of these ACL injuries are non-contact. So no one around, change of direction, a twist of the lower leg, the ACL pops. And what happens is the muscles, they don't fire at the right time. Just a fluke occurrence. Unfortunately, that lower leg bone slips forward as opposed to the upper leg bone, and you get that ligament just having a complete rupture.
What about, Brian, the treatment, the actual surgery, the different methods and the parts they use, bits of hamstring, bits of tendon from elsewhere?
So look, there's probably 4 major ones, or most popular ones that they use in the NRL. If we look over here at our muscle mean, you can get one from your patella tendon, which is down here, your quadriceps tendon, which is up here, or your hamstring tendon, which is around the back. But one interesting one that I've seen become quite popular lately is actually what we call a donor tendon, which comes from a cadaver or a dead body. That can come from the patella tendon or the Achilles tendon. Now that is quite, I guess, attractive because it means you don't have multiple surgical sites, and they're finding that the return to play is actually that little bit quicker.
Well, we always like to finish the segment with the expected time frame that a player is sidelined. Best case scenario with modern medicine and what we now know and rehabilitation, what would be the quickest amount of time that you could expect an NRL player to make it back?
Look, minimum 6 months. You know, we're always pushing the ladder time and time again, but usually minimum 6 months. Most of your NRL players fall in that 6 to 9 month range. All
right, well, sadly, knee reconstructions and the ACL injury is just part of rugby league. Brian Sini, thank you for coming on The Fan, as always.